BioFemme Zon Control. The BioFemme Zon Control is a powerful organic solution designed to treat vaginal yeast infections within 3 days. It is specifically formulated for women who have developed or who are prone to yeast infections. It is estimated that more than 3 in 4 women will be affected by a vaginal yeast infection at least once in their lifetime. This is why the BioFemme Zon Control will be also ideal to prevent vaginal yeast infections without side effects. The vaginal flora, also known as the vaginal microbiota, is made up of the balance between microorganisms, including good bacteria such as lactobacilli and yeast. Lactobacilli produce lactic acid, which helps maintain a healthy vaginal pH, ideally situated between 3.8 and 4.1. This acidic environment helps to prevent the overgrowth of most pathogens and preserve the proper bacteria-yeast ratio. Unfortunately, this ecosystem is very delicate and many factors can easily disrupt it. When the number of lactobacilli decreases, for instance, some yeasts, such as Candida albicans, overgrow and trigger a vaginal yeast infection. The symptoms of a vaginal yeast infection include thick vaginal discharge similar to cottage cheese, itching, burning sensation, redness, swelling, pain, and discomfort, particularly during intercourse. Hormonal fluctuations may imbalance the vaginal pH and reduce the amount of lactobacilli, making the environment more prone to yeast infections. This is often the case the week before menstruation, while taking birth control, during menopause or pregnancy. Many other factors may affect the vaginal pH and contribute to the overgrowth of Candida albicans, such as antibiotic intake, high sugar levels, period of stress, tight clothing, synthetic materials such as underwear, latex, tampons and pads, warm bath, swimming pools, vaginal douches with products containing perfumes, or the lack of hygiene after intercourse. Advantage number 1. Powerful antifungal effect. The BioFemme Zon Control is a powerful antifungal. Made with fungicidal minerals and purifying salicylic acid, this treatment helps to bring back a healthy vaginal flora by neutralizing pathogenic yeasts such as Candida albicans. It also helps to promote the natural production of lactic acid to restore a healthy pH. Microbiological tests have shown that using zone control eliminates more than 99% of Candida albicans strains in less than 7 days. Advantage number 2. Soothing effect. BioFemme Zon Control contains an anti-inflammatory synergy of hawthorn and aloe vera extracts to immediately relieve itching, burning, swelling, and irritation associated with vaginal yeast infections. For all women prone to chronic vaginal yeast infection, it is important to regularly monitor the vaginal pH using a pH strip. Insert the colored part of the pH strip directly inside the labia minora so that the paper comes fully in contact with the vaginal wall. Hold for 5 seconds, then remove the pH strip and compare the color with the color reference scale. A normal pH is ideally between 3.8 and 4.1. A pH between 4.2 and 4.5 will require preventive treatment with zone control for 1 day. If the pH is above 4.5, the lactobacilli are in small amount and a yeast overgrowth is present. A treatment of zone control for 3 consecutive days, morning and evening, is required. How to use it? If you have a yeast infection or if your pH is above 4.5. Use the zone control in the evening after cleansing the intimate areas with BioFemme cleansing foam. Apply 1 pump of zone control to a tissue and wipe the intimate areas directly. No rinsing is required. The following morning, clean the intimate areas with the BioFemme cleansing foam and reapply the BioFemme Zon Control. Perform this procedure for 3 consecutive days, morning and night. After 3 days of zone control treatment, Apply the BioFemme pH balancing gel or the BioFemme soothing gel to the intimate areas morning and night for a minimum of 1 week. If your pH is between 4.2 and 4.5. For 1 day only, use the BioFemme Zone Control morning and evening on intimate areas after cleansing with BioFemme cleansing foam. The following day of the Zone Control treatment, use BioFemme pH balancing gel or BioFemme soothing gel on the intimate areas morning and night for a minimum of 1 week.